We present the case of a 38-year-old Gravida 6 Para 1 woman with a history of recurrent pregnancy loss. She has notably had 4 consecutive first trimester losses, all previously managed surgically via suction dilatation and curettage. She had undergone investigations for recurrent pregnancy loss and was found to have a large uterine septum. Uterine septoplasty under hysteroscopy was performed, and the patient was conceived spontaneously soon thereafter. She had a generally unremarkable early first trimester. Her viability ultrasound performed at 7 weeks and 5 days gestation by last menstrual period showed the gestational sac measuring 25.6 millimeters, a crown rump length of 6 millimeters, and absent embryonic cardiac activity. The diagnosis of missed spontaneous abortion was therefore made. Intrauterine pregnancy losses occurring approximately 15 to 20% of gestations, and in North America, about half of these losses are managed surgically. Current standard of care for surgical uterine evacuation of early non-viable pregnancies is via a suction dilatation and curettage, or commonly called D&C. This is a blind procedure involving suction followed by sharp curettage of the entire uterine cavity. Operative hysteroscopy has been successfully used for management of multiple intrauterine pathologies, including endometrial polyps, myoma, septums, and adhesions. FDA-approved MyoSure Tissue Removal System by Hologic is a suction-based hysteroscopic morcellation device that relies on mechanical energy delivered through a tubular cutter. The device allows for targeted resection of retained products of conception under direct visualization. Recent research has showed that hysteroscopic resection may be preferred to suction D&C in patients with retained products of conception. A systematic review reported fewer intrauterine adhesions and incomplete evacuations with similar reproductive outcomes when comparing hysteroscopic resection with suction D&C. Our objective was to assess the feasibility and efficacy of targeted hysteroscopic resection for a missed spontaneous abortion. The surgery took place at the Regina General Hospital in the gynecology surgery suite. Patient was placed in the dorsolathectomy position and received general anesthesia with all complications. She was then prepped and draped in the usual sterile fashion. A speculum was placed in the vagina and the anterior lip of the cervix was grasped transversely with the single-toothed inoculum. The operative hysteroscope was introduced through the cervix, allowing visualization of the uterine cavity. Hysteroscopic visualization of the uterine cavity revealed products of conception, including the gestational sac. Normal saline was used for uterine cavity distension, connected to the Equilex fluid management system. We then proceeded with targeted hysteroscopic resection using the MyoSure device. MyoSure device was developed in 2009. It has a rate of 6,000 revolutions per minute and is able to remove 1.5 grams of tissue per minute. As demonstrated, the morcellator was able to remove the gestational sac in a sequential fashion with little bleeding. The tissue is first drawn into the morcellator window and is then resected and suctioned away. We were able to achieve complete removal of all products of conception. Common risks of this procedure include fluid overload, electrolyte disturbance, bleeding, infection, uterine perforation with subsequent injury to bowel, bladder, and surrounding pelvic structures, retained products of conception, and risk of anesthesia. Once the resection was complete, the uterine cavity was deinsufflated. All instruments were removed and patient was taken to the recovery room in stable condition. The fluid deficit was 350 milliliters at the end of the procedure, and there were no other operative complications. Estimated blood loss was minimal, and total surgical time was a little under 10 minutes. To the best of our knowledge, this is the first surgical video of a targeted hysteroscopic resection of a missed spontaneous abortion. Our patient was discharged home on the day of surgery. Postoperative bleeding resolved within 24 hours of surgery, and she had adequate pain control with oral analgesics. At the 6-week postoperative follow-up visit, she underwent a second-look hysteroscopy, which showed no evidence of retained products conception or intrauterine adhesion formation. In summary, targeted hysteroscopic resection using a suction-based morcellator device is a safe and effective way of surgically managing first trimester missed spontaneous abortions, especially in patients with a prior history of recurrent pregnancy losses or intrauterine pathologies.